In the Bible, in Luke 12:48, it says, "Too much has been given, much more will be required." I feel really strongly about that verse.
Michael Haglund has dedicated much of his life to the service of others. He has put his deep Christian faith to work,
because in your precious name we pray, Jesus. Amen.
Organizing medical mission trips to Ecuador and bringing modern neurosurgery practice and training to several African hospitals.
I feel like part of what we should do as Christians is give back.
Much of Haglund's mission work today is focused on Uganda, inspired by a serendipitous meeting with a Ugandan pastor who visited Haglund's church in Raleigh in 2006.
Right before he left, he said, "Dr. Haglund?" I go, "Yeah." And he goes, "You're going to go to Uganda and do great things for God." And I go, "Well, no, I actually go to a different continent. I go to South America and Ecuador." He goes, "No, this is a word from the Lord for you. You're going to go to Uganda."
Haglund visited Uganda several months later and describes the surgical setting as horrific, with just 5 modestly trained neurosurgeons serving the entire population of 30 million people.
1,500-bed hospital, twice as big as Duke Hospital, 1 ventilator for the whole hospital.
So Haglund had an innovative idea. He knew that Duke had a surplus of used medical equipment stored in a warehouse.
And I found more monitoring equipment that they had in the whole hospital in Malago and brought it home in my car.
That was the 2007 genesis for the Duke Global Health Plus program, which stands for Placement of Life-Changing Usable Surplus.
And in 2 days, we had a team of 24 people that all wanted to go. Some of the best CRNAs, my neurosurgery residents, OR nurses, ICU nurses.
For 11 years, Haglund has brought a Duke team to Uganda twice a year. To date, the Duke Global Health Plus program has donated more than 90 tons of medical equipment to 3 Ugandan hospitals. He has developed neurosurgery training programs and created Uganda's first neurosurgery residency program. His program trained Uganda's first ever female neurosurgeon.
It doesn't do us any good to go over there and do surgeries and then come home if they can't carry it on. They're excellent surgeons. They just didn't have the equipment and the technology.
Haglund was born in Minneapolis. His father was a PhD in plant biology, which inspired Haglund's interest in science and math.
So I was interested in research, but I wanted to not be a plant doctor. I wanted to be a people doctor.
After neurosurgical residency, where he published several important papers on epilepsy, and following 2 fellowships at Harvard, Harvard offered him a coveted full-time position. But
then I really felt a tug on my heart and it said, this is not it. And I said, you know, I talked to my wife last night. I think we need to pray about this a little more. And my next interview was at Duke. And I loved it. I mean, Duke had everything I wanted. Had a great epilepsy program, had a great neurosurgery department.
Haglund came to Duke in 1995 and became an established expert in spinal surgery and the surgical treatment of epilepsy.
And so the minute I came out here to Durham, I said, I'm going to get involved in humanitarian work.
He then went to Ecuador, where he ministered to hundreds of children and adults, many of whom had never before seen a doctor. He visited Ecuador annually for more than a decade and established a self-sufficient medical clinic there with fellow Dukey Tim Driscoll and others from Duke Hematology Oncology.
So it was a pretty strong start to doing this kind of missionary work.
Haglund also volunteers at the North Carolina chapter of the Royal Family Kids Camp that serves abused and neglected foster children. In 2014, Haglund helped to found the Duke Division of Global Neurosurgery and Neuroscience, which currently has 100 people working with Ugandan colleagues. And he is volunteer coordinator of the Foundation for International Education for Neurological Surgery. His many honors include the Humanitarian Award from the American Association of Neurological Surgeons and the Ugandan Citizenship Award presented by the Ugandan president. He and his wife Christine have been married for 38 years. Their son Sean works in the tech industry, and their daughter Tanya is a dancer and singer on Broadway. In addition to hiking and cycling, the Haglunds are passionate about Duke men's basketball and rarely miss a home game. Something else that Haglund rarely misses is his opportunity to share his faith through tireless mission work, both locally and around the world.
And so that's the most important thing, is to be able to give back to people and make a difference in their lives. And it's just been amazing and humbling and a real blessing.